Happy New Year from the NAAOP. This is Peter Thomas, the General Counsel from Washington, D.C. We've got a very full agenda this year in Congress and with the new Trump administration and his appointees in the healthcare area. We are already underway. The Senate just yesterday introduced a reconciliation bill, ultimately that would repeal the Affordable Care Act. That's not a bill that would eliminate the law in its entirety tomorrow. It's a bill that sets up a framework for the Congress, particularly the authorizing committees, the Ways and Means Committee and Energy and Commerce Committee in the House and the Finance Committee in the Senate, to look through the Affordable Care Act and determine which provisions will be repealed, which will be altered, which have to be omitted from the bill because it's a budget bill and all of the provisions need to impact the budget either in a positive or negative way. So there'll be a time over the next several weeks where the Congress examines how to go about repealing the Affordable Care Act, but all bets are that this is a goal that the Republican Party has had for some time and will likely be achieved under the Trump, especially with the Trump administration holding the White House. The second set of issues involves the Medicaid program, not only a repeal of the expansion of Medicaid, but also a block granting of the program and potentially limiting the federal share that states receive to provide care to Medicaid beneficiaries across the country. This really is quite a threat because it will not keep pace. Whatever federal funding currently is in place will not keep pace in the future if they pursue this approach, which means that states need to pay more for Medicaid or cut benefits, and likely many states will need to cut benefits. Finally, the Medicare program is also on tap, and we expect a second budget bill later this year, which of course requires only a 52-vote margin in the Senate to pass rather than the traditional 60-vote margin. And we do expect Medicare to be included in that package as well. That offers opportunities for the O&P Alliance and the O&P organizations to try to include some of the O&P provisions of the O&P Medicare Improvement Act and other provisions that would be positive for O&P. But it also offers tremendous threats to the many aspects of the Medicare program. So by and large, on both the three major programs that provide health care in this country, the Affordable Care Act, the Medicare, and the Medicaid programs, NAAOP is going to be extraordinarily busy this year. Also wanted to brief you and very quickly update you on the lower limb prosthetic LCD. As you all probably know, the interagency work group on lower limb prostheses was compiled as a result of that LCD and has been working largely, completely shrouded from the public with virtually no public input for the past year. We expect to hear from them if the current Trump administration continues its policy in the near future, probably by the end of the first quarter of 2017. We don't know what they'll say. We expect that there'll be a public comment period for whatever they do publish. In the meantime, the Agency for Healthcare Research and Quality has issued back in December a request for comments on really the evidence base around lower limb prostheses. And the O&P Alliance, as well as many other O&P organizations, extensively drafted comments or drafted extensive comments and submitted them to the AHRQ. So plenty to do this year. We thank our members for their past support and current support, and we look forward to working with you in 2017. Happy New Year.